Hello, everybody. Welcome to today's live. Today, we're going live with an organization called the Counselling Hub, and we will be speaking about the affordable counseling services. And we'll be getting to know them and a lot about what they do, how they do it, and why they do it. I see they just requested, so I'm going to accept.
Good morning.
Hello.
Good morning. How are you?
Good morning. Oh my hair. Man.
How are you? Good. I'm good. How are
Thank
you
you.
doing?
Oh, it's all good. Keeping warm this side.
Is it cold?
Yeah.
I'm in a short sleeve. The sun is shining. Life's good this side.
It's not a good line.
Is
Okay.
connection bad?
A little bit,
Little
but now
bit,
I think it's
but
okay.
I think it's all right.
Okay, cool. So I'll get it started. I'll do a short intro. I'm not going to read the whole bio because it takes away the fun. So I'll read a few things and then I'll hand over back to you. But maybe to introduce myself first, because obviously there's the Counselling Hub community. I am Kwezi and I'm a mental health advocate, very passionate about having these conversations and raising awareness on mental health issues. But I think most important is giving people information on organizations like you. You know, a lot of people don't know that they can come to you guys for assistance. And when I found out, I remember when I met Shifra, I was like, how did I not know about this? This is so amazing. So I'm very excited to have you guys here. So joining us is Shifra and Loveness. Shifra has such a long bio, everyone. It's long, but I guess it makes sense because
No, don't worry.
So I'll just highlight a few things. You are a human rights and social justice advocate. You describe yourself as a lifelong learner as well as an adult and popular educator. You've worked for the Grassroots Educare Trust. You've worked for the Desmond Tutu Peace Center, Nelson Mandela Children's Fund, and a lot of other things. I'll let you tell us a bit about yourself. Then Loveness is a social media manager and an event coordinator. She is an accomplished social media manager, like I said, with a Bachelor of Arts degree in psychology. So maybe also Loveness can tell us if she works in the Counselling Hub because she's very passionate about psychology. So maybe Shifra, the reason why you do the work that you do and why you joined the Counselling Hub, and then Loveness can also tell us a bit before we.
I don't need to speak. So my name is Shifra, and Shifra was Moses' wife in the Old Testament. So I'm a midwife of sorts in that I like giving birth to projects predominantly. So I've been in the NGO, NPO sector for 45 years. I'm 70 now. And yeah, I think I was born an activist. Well, my family were activists. So I was born into activism. And that was around politics in South Africa. I was born in 1915. So, and 88, which started and what's it called? An advanced diploma in adult education at UWC. In England, when I was living there, I became a movement specialist. Either a mentor a counselor or a supervisor. So here I am today, still passionate and positive.
Woohoo! I mean, what do you say after this loveness?
I mean, she literally just closed it off. But yeah, like events coordinator here at the Hub, and I did study a bachelor's of arts in psychology, and I just love, being able to assist people, and the Counselling Hub, is doing a lot of that. And yeah, I wanted to know how I can play a part in trying to, spread the word out there about counseling, and also, destigmatizing it. And that's how I came about to be here.
Okay, awesome. Thank you. It's so lovely to meet you. I know I've met Shifra, but you and I have been speaking on email, but we've never really met in person. So you've got a beautiful smile.
Yeah.
So happy to have you. So maybe
Thank you.
start with maybe why the Counselling Hub was started. What's the vision? What's the mission? What are you guys trying to achieve?
Okay. So we started the Counselling Hub in 2019. Literally a year before severe COVID. And the idea was, well, I got a phone call from this woman, Romy Kaplan, who said to me, would you like to be the coordinator or the director of the Counselling Hub? She said, I've heard good things. I said I would love to, because I was being retrenched that year because I was 65. So I never really thought that there would be a full-time job after that. So it was wonderful. And really from the beginning, we used social media to get the word out. We also had a launch. And what we wanted to achieve was affordable, accessible, and quality counseling that is inclusive of mainly people who have never been able to afford private therapy or have been in touch with the public health sector and just found that there was, a lack of service, essentially. So we felt like we were covering some gap, and that we would concentrate on underserved communities, low to middle income, and that we would ask for a donation of 50 Rand a session. So, and we also decided that we do short-term intervention, one, so that we could get more clients, or that we'd be able to see more clients faster. And we also felt it was a very good way of working, because the modality is strength-based. And what's that? Now I can't think of the other method that we use, but it will come to me. This is how the brain works at 70.
Don't worry.
So we use two modalities, as well as eclectic. In other words, whatever the volunteer who is qualified brings to the session is what we're satisfied once we've done an induction training with new volunteers. So we'll speak about our values, and our values are very much about non-judgmental, interfaith, inclusivity, no discrimination, all those kind of good philosophies. And we started out, and that was it. We built a live diary online, and literally it wasn't automated in the same way as even 5 years ago. Things were different to now. So we started off very shakily, but very convinced that what we were going to offer would be a success. And literally within the first year, 2 years, we were seeing, 30 20 clients a week, 30 clients a week. And because because we are a project of the SACAB Foundation, South African College for Applied Psychology. So Romy and SACAB Foundation were the co-founders, and they had NPO status, their foundation. So we became their first NPO. And I think within, the 5 years, we've achieved an enormous amount. We've added to our talk therapy program, which is how we initially started. Then came COVID, and we absolutely had to change to online and remote counseling. And now we find that 70 or even more % of our counselors are remote or online, because it's a really easy way of reaching people. I do believe that face-to-face just has easier benefits just because it's face-to-face. But nothing wrong with online counseling, especially if people have platforms where they can see one another, like WhatsApp call, Zoom, etc. Otherwise, it's just a regular call or a WhatsApp call, and we've had a lot of success and a lot of feedback from clients about how they feel they have learned to face their life challenges, which is our aim primarily, is to help people live and live better with their life challenges. Therefore, the client having an impact on their family, the family having an impact on the community, and therefore it's a more holistic endeavor.
Love that. So someone asked if you can explain more what you mean when you say you do short-term intervention.
So we offer 4 to 6 counseling sessions. So they'll have one session per week for about 4 to 6 sessions. So yeah, trying to make sure, that we can help as many people as we can. Hence why we offer a short-term based counseling.
Okay, cool. Thank you. I see the questions are coming up. Maybe we won't even get to the ones I prepared, but I don't know.
Okay.
Someone says, quick question, online counseling has many benefits as well as reaching more clients, which I do agree of. I think it speaks a lot to the accessibility. But do you think that online counseling takes away from human connection in any way?
I actually haven't read studies, and you're reminding me that I need to see, yes, the impact of remote online counseling.
Yeah.
As I say, the feedback that we get is very good, and we've had hardly anybody have any trouble, clients or volunteers, with online counseling. It does obviously take away, if you're not seeing the person, a little bit from the human connection. But I think there's a much deeper understanding that this is a convenient way and to be used and to be bolstered, because it's still a way that people can talk about, their perceived issues and get help for it.
Yeah, and to add on to that, with technology, it's so advanced now that you can have like here, we're able to see each other face to face and have that conversation. And most people, the type of issues that they want to come to counseling for is very different and diverse. You might get someone who has social anxiety. So even for them, being face to face in person would be, something that brings about a bit of trauma or that will impact on the session. So I feel having the online aspect of counseling or to counseling has actually been an added bonus, as well as now we can encompass all of those requirements.
Just to confirm, do you only do online, or is there an option to see someone in person?
Oh, yes, no. We have offices in Woodstock, in Cape Town, and we have 5 counselling rooms. We just moved in January where we had 3 counselling rooms. And we were always overcrowded or, overbooked. So now it's wonderful. And now we're trying to build our face-to-face counseling as well.
Okay, cool. Then someone could say, I can go to a government hospital and get it for free. What's the difference between, I think I know the answer, but I want, I want to hear it from
Yeah,
you.
yeah.
What's the difference between going to a hospital where I can get counseling for free and calling you guys and getting it from you?
Okay, so a public hospital or community hospital has very few mental health practitioners. Just for you to know that the 2023-230 white paper from South Africa, there is one psychologist to 100,000 people. I mean, that is insane. So
Yeah.
when clients do go to the clinic, what they will have success around, and it might be a long process, they might have to come back a few times because there's no psychiatric registrar at that hospital. They've stopped the course for psychiatric nursing, so we don't find psychiatric nurses at our day hospitals anymore. In fact, it's a dire situation in the public health sector. So what they would have access to, which we don't and we don't want to, is if a person needs medication, then the hospital would do one assessment and would decide maybe this person is clinically depressed and they need to go on, an SSRI or an SNRI. Honestly, that is the only benefit I see. Otherwise, people tell us they wait in queues, they wait for days, and we send them with a letter. But the letter is to the medical registrar. So then the registrar has now got to find a psychiatric intern, and they're just fewer and fewer.
Yeah, and to add on to that, like we mentioned, we offer short-term counseling, of which if you were to go to a hospital, you might get one session and then get put on meds. Whereas here we offer 4 to 6 sessions, so you can keep on coming back for those sessions to keep on working on yourself. Whereas if you were to go to the hospital, you'd have your initial first session, maybe a follow-up, but then you'd get put on meds. So we try and, encourage for oneself to grow and, develop and learn how to cope without having, to immediately resort to coping mechanisms, like medicine. So we try and empower the individual themselves before we can, say, okay, you need to go for psychiatric evaluation. Yeah.
Okay, cool. I was actually going to ask if you do referrals when you see that someone needs that further intervention, but I think that answers my question. So
Yes.
Shay Singh says, do you have any advice for an honors psych student wanting to build on my experience? Organizations I've volunteered at experience similar challenges, such as low on resources needed to reach more people.
So I didn't really understand the question.
I think what Shay is asking is, do you have any advice for an honest student that wants to build on the experiences? Because you obviously work with a lot of volunteers. So have
Yes.
you noticed anything and any advice that you can give them? And I know there's other counselors here. So if anyone has any further advice to give, can you just also add it to the comments?
Okay. So, because we chose to only work with adults because we felt, one, we were connected to SACAP, and most of the students that come to us for their placement site, it was for 3 months, and now it's moving over to 6 months. So to have steady volunteers for 6 months is just amazing. However, we do need our students either to be on the World Program at SACAP, which is the Work Integrated Learning, or they need to have had experience counseling adults. And the way to get in with us as volunteers is to either do the Lifeline, Personal Growth and Communication and Counseling course, or FAMSA. These are all in Cape Town. Also offers counseling courses, and Hope House, which is also in Cape Town. So we would advise them to go and do that basic training again and then come back to us, and we will certainly take you on.
Maybe even emotion aid.
And emotion aid, yes. So besides our talk therapy program, we have other programs.
Okay.
So we have a learning center, which is an online library for worksheets, articles, coping mechanisms. So our student, and it's being built, it gets built every time we have a new cohort of students, which is really amazing. So we've got some incredible resources there. But what did you ask me initially?
I think you've answered the question. And you've given me additional information, which I think is helpful. Yes.
Emotion aid is a program that we got involved in about 3 years ago. And a lot of counselors and staff got trained by the International Trauma Association. It is emotion first aid, and it's a protocol of 5 steps, which are somatic steps to help the person emotionally regulate, and also to go on a stress scale and to see what happens when we do all 5 protocols. So we'll ask in the beginning, what is your stress like today? 1 being bad, 2 being good. And then we'll ask those questions again. And what we found is people's stress levels go down.
Oh, wow.
Yeah, so I'd say emotion aid, so other than, the FAMSA that Shifra recommended, I'd say, emotion aid is also one of those courses that would be nice to have up in your CV. And then just keep on volunteering and gaining those hours of experience, because what we find with organizations, even ourselves, is that, when we see someone come through to us and they show us, so I've volunteered with this organization, I've done this course, keeping up to date and updating your CV and your accolades, I would say, will definitely help you get up there.
Yeah.
Okay. And is emotion aid only for mental health professionals, or can anyone take it?
Anyone can do it. Anyone.
Okay.
Yeah.
And do I spell it emotion aid as in first aid?
Yeah, just one word. Emotion with a capital E and A with a capital E, with a capital A. Yeah.
Okay, cool. Then what did I want to ask? Okay. I think, Shifra, when we met, you mentioned that we can get counseling in our own home languages because you've got so many volunteers. Is that true? Because I've been preaching that gospel. I hope I wasn't lying.
No, we do have counselors who speak different languages. I don't think we cover the 11 or 12 languages in South Africa, but we definitely have counselors who can speak Xhosa, Zulu, Pedi, Tswana, and I'm sure a couple of others. Yeah. Afrikaans.
Okay. Yeah.
No sign language. We don't have a signer yet, and that's considered a language.
Yeah, we should get a sign language one. That's a nice point. Okay, so how does someone book a session?
So with booking a session, what they can do is they can send us a WhatsApp. So we try and keep, communication very close and personal, I would say, and try to assist them immediately. So they'll send a WhatsApp to our number 067 235 0019. And then once they've sent their message, they'll need to come through with their name, surname, email address, and also just a brief reason of why they're seeking counseling. It could range from depression, anxiety, or just wanting to work on yourself and learn how to cope better with environmental stresses or internal ones. And then once we have that information, we then, try and match them up with a counselor as close as possible to, their preference. For instance, if they want someone who speaks Afrikaans or Pedi, then we try and match that up. And then, we book them in for about 4 to 6 sessions. Otherwise, if we do have a lot of, people coming through, our waiting list will be from about 2 to 3 weeks. And but for the face-to-face at the moment, they are getting immediate bookings, if not being on the waiting list for 1 week.
Okay. Then like how SADC has a helpline for people who are in distress and people who feel like they're suicidal and they need immediate assistance. Do you provide that, or would you suggest that people still go to SADC because obviously SADC deals with it immediately?
I think it's best they go to SADC. When we do have clients who are suicidal, well, there's 3 aspects to suicide. There's ideation, which is where they're thinking about it and they're talking about it. And our policy is very open to, and we train our counselors to work with destigmatizing suicide or talking about suicide. If the client has a plan, then we will be more careful about, and we'll give them the referrals already. And as you know, there are lots of referrals, even besides, say, SEDAG, they're 24-hour lines. Or they would phone their counsellor and say, can I have an emergency meeting? Or the counsellor could send some tools that would help the situation.
What other helplines are there, just so people know? Lifeline. Is Lifeline one of them?
Yeah, Lifeline is one of them. We can tell you the lines. Sorry, it's just taking me a second to find. We have a referral booklet, which we can also send digitally. So I'm quickly looking through for hotlines.
I'll also just add them on when I save this video, I'll add it on the comments for people to go back and refer to.
Right. So we've got a lot of the haven shelters, the homeless shelters.
You've turned sideways now.
We're just trying to set ourselves up a little better.
Okay.
Yeah, I think that should be fine. There we go. Is that okay?
I think no. Can you turn the phone around? Because now I think you put it sideways.
Oh, okay.
Yeah, now it's better. Perfect.
Okay, here we go. Yeah, you can carry on. There we go.
Okay, so some emergency counselling helplines. There's a national counselling helpline. There's Dr. Reddy's helpline. There's a SIPLA 24-hour mental health helpline. There's a pharmacodynamics. There's Adcock Ingram. There's the ADHD helpline. There's the suicide crisis line. Do you want that number?
I'll ask Loveness to send me that one, because you said there's a digital one.
Yeah.
I'll just copy all the info.
and then there's SADAG.
Okay, there's a lot. There's a lot of
Yeah,
options.
there's quite a lot, even more. There's Lifeline, there's a people opposing women abuse helpline. So there are quite a lot, yeah.
Okay, cool. Maybe one more question. Let's see. So, are there different types of counseling, or is there just one? Because I think you mentioned there's talk therapy, but do you guys do others besides the emotion aid?
Well, we do the emotion aid. We're starting a program with ecotherapy. So where we look at how to sustain our counseling, and we've got a garden, and we have workshops at the garden. And then I'm introducing a creative, expressive arts therapies program where we're going to learn techniques around movement, dance, music, drama, yoga, and mindfulness.
Wow, that sounds exciting. Maybe I should move to Cape Town so I can be a part of it.
So.
Someone asked here if it's possible to volunteer from Joburg.
Yes, as long as they've had experience counseling adults.
Okay.
Absolutely. They should write to our info@counselinghub.org.za.
Let me write it here. Info
at counselinghub.org.za. And just say, volunteering.
Cool, no problem. One last thing. Do you guys take donations further than the 50 Rand that people pay for counseling? Are you accepting donations?
Yes.
And how else can people get involved?
Well, they can go to our website and they can give us a donation through the payment methods, which are described on the website, or they could just contact us if they want to give donations. We are entirely funded, so we're always looking for funds. And but we do have the support of the SACAP infrastructure, which helps a lot.
Okay. Cool. One last question. So let's say I don't have 50 Rand at all. My last 50 Rand I'm going to use to buy bread, but I really, really, really need help. Is there an option to get assistance for free?
Well, we're certainly working on that. And we did have a bursary fund, which is up now, but that's what people could do. We want to start a campaign where people buy a counseling session for an underserved person. And that would be marvelous. Then we would have, money for, like we had one client, I'm not going to mention anything, but that person just couldn't pay their transport home. And we helped them out. But it's not something we can do readily because we don't have the funds.
Yeah.
But if that's something, maybe Loveness is going to develop a social media situation around asking people for donations to help another person have a session. I think that
can I tell you there's a coffee shop down the road. I stay in Four Ways. It's called DC Coffee Co. So what they do is they've got an option where people can buy coffee for someone. So they have this cute little station where you buy a voucher for someone, you can write a message for them. Either you can buy it for someone or you can buy it for a stranger, and then people get there and they take the coupon and then they get coffee for free. So sure, we can see. Let's chat offline and let's see. Maybe that's because I recently registered an NPO focused on mental health. So maybe what we can do, we can see maybe that could be one program that I could be a part of as well. I think that's a nice initiative, actually.
Oh, I think it would be fabulous because we are seeing a lot of problems, because of the economy, because of the state of the world.
Yes.
We are seeing people, and maybe that's also why people don't come in face to
Yes.
face, because
Yeah.
it's travel, the donation, and travel back. So if we could
Exactly.
get a system going where we get other people for who it's more affordable to buy vouchers for counseling sessions,
Yeah.
that would be marvelous.
That would be amazing. Thank you so much. This was such an
Thank you
informative live,
too,
and
and
so
stay
nice
in
to
touch
see
with
you.
us.
Definitely. After this live, I'm emailing Loveness. Have a
Okay.
I look
beautiful
forward to
day.
it.
I
Thank
look
you so much,
forward to
Kwezi. It
working
was
with you.
wonderful.
Thank you. Lovely to
Okay.
have you.
Bye.
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 Bye.